Hi, Mayor Bowser. Thank you for making time for this conversation today.
Thank you.
In the midst of health and financial and social crises, and your time, I know, is a bit stretched, to put it mildly. You've now served as the mayor of DC for over 5 years, I believe, and I can only imagine that this first half of 2020 has tested you in the district in ways you never could have expected. In the wake of the pandemic and the recent national conversation around systemic racial inequities, many observers have noted a marked change in your leadership style. And I read a Los Angeles Times article, I think it was earlier this week or last, that even said, quote, that Mayor Bowser has had a metamorphosis from mild-mannered technocrat to something of an action hero. And I sort of love that quote. I want to get your perspective on it. But before we jump into that, I want to talk about COVID and the health of the residents of DC. How are your residents doing? Are you seeing rates continuing to increase? Are they on the decline?
Our experience with COVID is declining, and we are slowly reopening our economy and services in our city. But we recognize that the experience with this pandemic is uncertain in a lot of ways. So we see states around the country who opened in some cases earlier or who had lower cases at the outset, now seeing spikes and stresses on their hospital system. And we certainly don't want to see that happen as we reopen. So we have, to your earlier point, no one could have expected that we would have to shut down a booming economy to address a health pandemic that created an economic stress on our city, but that's certainly what we're experiencing. I couldn't be prouder of our team who have reacted quickly and with great expertise and execution and have communicated that to our businesses and residents in an amazing way.
So with that, I believe the city just moved into phase 2 of reopening.
Yes, on Monday we started phase 2.
Do you have indicators that you are watching out for that would indicate a resurgence that might slow the reopening or even move us backwards?
We do. We're certainly monitoring how we can get more activity going in our city. We still have the vast majority of people teleworking. We have restrictions on large gatherings, which affect a large part of our economy and conventions and tourism. So obviously all of us across the country want to get back to people being able to visit our city and do business the way that we have previously. So we're working very hard on watching what happens. Now we follow the metrics about reopening, which would also tell us if we had to dial back some of our activity. That includes how fast the virus is spreading, which we're seeing slowed spread in our city, but also how quickly we are able to contact trace and how much space we have available in our hospitals.
Yeah, and you mentioned the economic part of the equation. I mean, under your tenure, DC has seen tremendous growth and prosperity. Are you concerned about us being able to recover? I'm a longtime resident of the DC area, so I keep saying us. But what's your outlook for recovery? What's that going to look like?
I'm extremely optimistic about it. We went into this pandemic in very good shape. Our reserves full, attracting businesses and residents, our schools on surging, and we just went in to this pandemic in very good shape. So the fundamentals of how we operate our city are good. We so far, knock on wood, haven't seen the job loss that a lot of areas have seen. We've doubled, our unemployment is doubled where it was, but it's not in the 20s, which is a good thing. So we feel very strongly about our recovery. But more than that, we've had the time to look at some things that have been, that we've learned from during the shutdown that may be good for how we operate. And so we have had an outstanding reopen committee led by Susan Rice and Michael Chertoff, 11 sector committees that looked at how we do business and made some recommendations about slowly reopening. So we're going to continue that work during our recovery.
There's been some talk, particularly in New York City, and I haven't heard it as much about DC, about residents leaving the city, having a change of heart about living in big cities after this pandemic. Are you seeing any signs of that, or do you share those concerns for DC?
Share those concerns, and I think any mayor who told you that they didn't wouldn't be being totally candid. But the truth is, I think it could be temporary. I do think that some people who are working from home are going to say to themselves, hey, you know, this isn't so bad. Maybe I don't need that office after all, or I could work anywhere. But at the end of the day, the things that make cities attractive, the culture and arts and ability to move around on public transportation, great parks and recreation, not having to own a car, all of those things are going to continue to be drivers for people when they think about where they move, and having good paying jobs. And we continue to focus on attracting not only the public sector jobs, but private sector jobs. And we have been a hub for attracting young tech talent, and we're going to continue to work on those things.
Yeah. Can we talk a little bit about, you know, in many ways, this COVID pandemic has laid bare many issues that we already knew existed, but maybe
Sure.
not as much light shining on them. And there's been a lot of recent national conversation over the past few weeks around systemic racial inequities in criminal justice and law enforcement. But COVID has really been able to shine a light on disparities in health.
Yep.
And last week in congressional testimony, I heard a witness say that the District of Columbia in particular had death rate that Blacks died at 6 times the rate of whites infected by COVID in the district. Is that true? And to what do you attribute that? And how can we fix that?
Well, I don't know. I would have to do the math, but 80% of our COVID deaths are among African Americans, and African Americans make up 48% of our population. So it is wildly disproportionate impact on African Americans. The rate of COVID infection, however, is even more significant among our Latino population, but not the fatalities. So you're right that this virus has laid bare centuries-old impacts of an unequal health system, education system, housing access, and poverty. The stress of poverty and the impact that it has on life expectancy is under-discussed. And so all of those things impact life expectancy in the district, where a white woman living on the west side of the city lives about 15 years longer than a Black man on the east side of the city. So those are real years, a real loss of quality of life, and a real impact on families in the city. What we've been focused on, we're working on a lot of different ways to impact vulnerable populations in our city, people over 65 who have pre-existing conditions, who may live in congregate settings, people who work for us, who we can also impact their healthcare providers and making sure that they're getting out, know the symptoms of COVID and are getting tested and isolated so that we can stop the spread of the virus in the community. And a lot of those strategies are working. A longer term, of course, we have to focus on how people get access to good, child and adult care, have access to specialists. And we're investing this year, have a proposal in front of the DC Council for 2 new hospitals, one on the east side of the city, as well as an ambulatory care center and one at Howard University, along with 5 centers of excellence that are going to focus on some of the debilitating conditions that concern us in DC, especially among African Americans.
Yeah. You, I know, have a DC Food Policy Council and have for years, and I believe you still lead the U.S. Council of Mayors Task
I do, yes.
Force. And many of these underlying chronic conditions that have been highlighted in association with COVID are diet related, obesities and cancers and heart diseases. And there has been more awareness of the need to get nourishing food to more people and to address food insecurity and healthy food access. Does the district have what it needs now to feed its residents and to get healthy food to all residents, or is there more emergency food relief that is needed through these coming months?
We have tried to be very aggressive about food during the COVID pandemic, and I think that we are serving our residents in a pretty remarkable way. We have, for example, food distribution at schools, not just for students, but for any resident that presents at the school. And in addition to having like a school meal, we're providing groceries that people can take home to their families. And we're doing that throughout the city. And that has been, we think, a safety net that has given people some confidence in the city coming back and their ability to take care of themselves while unemployment resources started to free up, and all of those things have happened. We think federally, we have to continue to pay attention. We were able to push back during this process some SNAP changes that would have really negatively impacted our families. We have also been able to get food delivery using SNAP benefits to families in the district, which we think is important and should be something that we look to long-term to help make families more food secure and eliminate this food access issue. But at the end of the day, we want a family to be empowered to be able to buy their own food in a way that is sustainable for them. I frankly cannot imagine, and most people cannot, what it's like to have to stand in a food line.
Right.
And as proud as I am that we're providing those resources, I desperately wish that people didn't have to stand in line for food.
Yeah.
I mean, it breaks my heart. I passed the line today, in fact, coming to the office. And we know people, they need good paying jobs. If we have people here who are undocumented and are not qualifying for unemployment, we know that there is a real lack of income for them. And people just want to be able to support their families. So the food security is a serious issue, and not just in cities like mine and urban areas. But we see across the nation stories that'll break your heart about people who have never applied for unemployment, never gotten food stamps, who are standing in line for food. And we're doing everything that we can to let them know that they are going to have what they need.
Yeah, it is heartbreaking. And it does feel a bit like the last few months have been heartbreak upon heartbreak upon heartbreak. And so I'm going to pivot us to talk about the national heartbreak around some of what we've seen in law enforcement. And a lot of the national outcry has been brought to the foot of the Capitol and the White House, and with protesters coming from your residents and from other states to join the protest in the district. Can you talk about, and I know this has brought you a lot of media attention, how you have handled balancing First Amendment rights to peaceful protest and the need to bring awareness to these issues with health concerns, with the ongoing pandemic, and
well, I hope that we balanced it the right way. I don't know if there is a perfect equation for it, but we are the nation's capital. So we support and police and clean up after First Amendment demonstrations all year, every year. And we're proud to have that responsibility, and we know how to do it. Our police department has worked with federal partners over the years to get it right. Unfortunately, this year we saw some political interference that upset that law enforcement cooperation, and I think made our city less safe, and certainly violated our birthright to First Amendment peaceful demonstration. So having said all of that, it is a delicate balance when talking about mass demonstrations in COVID. And I've been asked by our local press, how, just like you did, how do you balance it? So for the most of the government, the police department, these are First Amendment demonstrations that we have to handle. For the health department, for the DC Health Department, this is just a mass demonstration that everything we know about this virus suggests is bad. So we have been delicate, and we have encouraged demonstrators to use masks, use hand sanitizers, and to get tested and to isolate if they have any symptoms, or if they're going home to a person who is vulnerable, they should isolate. And so we will continue to do those things.
Have you, you referenced vaguely so the tensions between the federal law enforcement response to some of the protests and DC response, and the way you responded by requesting that Black Lives Matter be painted in big, bold yellow letters down 6th Street in front of the White House has become almost a defining visual and a galvanizing visual that we've now seen replicated in other cities.
Yes.
Can you talk about how that came to be and how you had that idea? And
well, I think for us, the specter of having the federal government take over DC streets was not only unnerving, it was offensive, and we thought it was possibly illegal. And certainly all of the efforts around federal law enforcement in the district during that week we thought were questionable. And we had to push back. Now, we don't have an army here in DC, but we thought we were right politically, morally, legally, and we pushed back with what we did have. And that was the goodwill of people, art, and that's what we did.
For all the sort of heartbreak and violence and political discord that we're seeing and seem to be dominating the media, can you share any stories of tremendous optimism or places where you've seen residents really step up and help one another? What keeps you going?
Well, I see residents helping each other all the time. And at Black Lives Matter Plaza, I've seen it throughout. After that night where people were cleared from in front of St. John's Church, many more people from the region who hadn't been involved in the demonstration showed up. And they showed up to push back, and they drowned out people who were there to be destructive. And they stood up for saying, this is wrong to use federal forces in this way. DC should not have its rights encroached upon. And that's why they started really speaking up. And you're talking about some attention that we've received. It's because people were finally opened up their eyes to, how can this happen in America to the people of Washington? And why doesn't their congresswoman have a vote? And by the way, why aren't they a state? And they really started to ask these types of questions, which is why I've gotten out just in as much time as I can spare to talk about it, that this could never happen in any state in the United States. Yet it's happening to 700,000 taxpayers in Washington, D.C.
The issue of DC statehood seems to come up every few years, and it has for decades and decades. I believe there's a new bill in Congress with new co-sponsors that's up for a vote in the House later this week. Do you think we'll have a different result this time than we've had in the past?
Well, I think that we're in the best position than we've ever been. And here's why. We started out in 2016, in the 2016 election, and we worked very hard to put a measure on the ballot for DC statehood. We had a new plan. We're following. I'll give you all the details at some point, but we follow the same plan that Tennessee followed to join the union. A lot of people think that becoming a state is outside of the first 13 colonies. All states have been admitted by a vote of the Congress. And so Tennessee, we followed that plan. We got a new measure on the ballot. Over 81% or 86% of DC voters voted for statehood. We created a new constitution. We have new boundaries that exclude the federal enclave, and the balance becomes the state. So we've done all of those things. And I felt it was important that if we ever had the opportunity with all of the political winds blowing in the same direction at the same time, that DC would be ready. It would not be any reason why we as a population were not ready. We've done all of the background work. We have the approval of our citizens. We are in incredible financial position to advance. All we need is for both houses of Congress and the White House to do the right things. Now, we were in this position another time, and I don't think DC was ready. So I made a commitment that if the time comes where all of those things line up, we'd be ready, and we're ready. But even we pushed ourselves really hard to get this vote in the House. And it's important for a lot of reasons. The Speaker of the House, the leader of the Democrats in the House, Leader Hoyer, both Marylanders. There was a time when Marylanders didn't support DC statehood. Now we had the Speaker of the House and the leader of the Democrats, Steny Hoyer, are Marylanders for DC statehood. That is so critical. And we have more sponsors than we need to pass the bill. So we know the bill will pass. And we have growing support in the Senate. So some Senate Democrats who weren't on board are now on board. So the momentum is incredible. But in addition to that, I'm calling on Vice President Biden, who's a supporter of DC statehood and has been, to make it his part of his first 100-day priorities.
Has he responded to that call yet?
He will. He will. We'll be sure of that.
You know, it's really incredible that you're taking on another fight on top of all of the things that you have to deal with in the district now. And so on a personal level, particularly as a fellow working mom, somebody who had to ride out this pandemic as a human, as a professional, just like all the rest of us, and dealing with all of these crises, how are you coping? What is your vision and dream of DC in the future that keeps you going and keeps you working so hard through all of this?
Well, my vision is, I'm energized right now by the comeback. And that's what motivates me every time. I was like really, the first couple of weeks of the pandemic response, I was in a total funk because it just hurt me that people who worked so hard to build businesses, people who lost their jobs, they didn't do anything wrong. And here their worlds were falling apart. And that has a trickle-down effect on us. We shut down our economy. I was preparing my budget, and I went from having what I thought were very transformative proposals to being $800 million down. So just imagine having to rework a budget and solve for an $800 million gap in a matter of a couple of weeks. So once I was going through the stages of grief for that change in about a couple of weeks. And then I said, this is our reality. We got to pivot and deal with our reality and do it as best we can. In terms of just personally, I think that Unlike a lot of people, I had to, my personal situation didn't change that much because I still was reporting to the office most of the time. My daughter is not in school yet, so her routine was kind of similar. But hovering above us was the specter of this very contagious virus.
Yeah.
And what does that mean for me having to go out to work every day and come home?
Right.
And so that was always too just a stress that a lot of people in essential roles were facing. Going out every day, being exposed, having to come home and still figure out your home life.
Yeah. Well, sadly, we've run out of time already, but I just want to thank you
Thank
for
you.
you and all the essential workers, and I'm energized by the comeback too. So
Yes,
thank you
let's
for
be
that.
energized for that. All right, great to see you. Bye-bye.